The HPA was conceived, written, and passed with the goal of empowering the two most important stakeholders in the medical system, our patients and their doctors. This bill is fundamentally about putting medical decisions back in their hands. For too long, insurance companies have used predatory tactics to make an extra dime at the expense of Illinois consumers.
In 2024, 2025, biosecurity is our nation's greatest national security threat. You need to think of it the same way we thought about the verge of nuclear, atomic, and in the late 40s, 50s, and 60s. I think we have to have that same vigor towards this biological gain-of-function research right now. It has the potential to be much more catastrophic than, let's say, an isolated nuclear event.
With millions of unauthorized people now on U.S. soil, living here in the United States, the potential for election fraud through ineligible voting is not just a hypothetical risk. No, it is a looming reality.
That's all just ahead in this week's edition of the Illinois Channel.
Thank you for all being here today. Governor Pritzker and distinguished guests, it's a pleasure to have you at Rush University Medical Center. Thank you for choosing Rush as a place to sign this incredibly important legislation. I am Dr. Omar Latif, and on behalf of the entire Rush University System for Health, we welcome all of you. While others will speak much more in depth about the Healthcare Protection Act and its importance, I just want to say that Rush was proud to advocate for the passage of this bill. Simply put, it makes it possible for all of us to help more patients in underserved communities, helping to ensure they get the access and care that they need. Ask anyone who works in healthcare. Our system needs work. But as someone who interacts with people on the front lines every day, I can tell you that the people in this space believe that healthcare is a human right and believe that getting access to the people that need it is critical. For everyone working on the front line, healthcare is a calling. Barriers to access like roadblocks from insurance companies dampen that spirit. This new bill is about holding insurers accountable and empowering patients and their doctors and nurses to make key decisions based on medical need and not what is profitable. We thank all of you for your leadership and dedication to the health and wellness of our city and state. It is now my pleasure to introduce the best governor in the United States of America, Governor J.B. Pritzker.
Wow, how nice. Well, good morning to everybody. Thank you very much, Dr. Latif, and to Rush University Medical Center for the very warm welcome and for your tireless dedication, all of you, for caring for the people of the city of Chicago and the state of Illinois. I want to especially say that, for a couple of years, Dr. Latif and I worked very, very closely together as we battled, all of us, COVID-19. And I must say, I was saying on my drive over here that there's nobody that I dealt with who was more helpful, who gave better advice, who was more available than Dr. Latif. So I just want to once again thank him. He helped us get past a terrible time. I am very proud to be here with all of you to stand up for the patients and families of Illinois by officially signing the Healthcare Protection Act into law. Over the past few months, I have traveled across the state of Illinois, talking to doctors and patients, to advocates in every corner of our state. And at each and every stop, I have been able to talk to people and meet with the same chorus of resounding support for this legislation. That wasn't a surprise to me. The HPA was conceived, written, and passed with the goal of empowering the two most important stakeholders in the medical system, our patients and their doctors. This bill is fundamentally about putting medical decisions back in their hands. For too long, insurance companies have used predatory tactics to make an extra dime at the expense of Illinois consumers. For too long, patients have delayed or been denied medically necessary treatments because of profit driver utilization management practices. For too long, shoddy networks, price gouging, and overly complicated bureaucracies have stood in the way of our families getting the care that they deserve. Today, with my signature, Illinois is addressing and rectifying that problem. When I proposed this legislation all the way back in February, I promised that I would put my shoulder to the wheel to get it done, and I did. This incredible coalition of experts and legislators, doctors and patient advocates put together a nation-leading bill that puts Illinois on the way to a better, fairer, and more affordable healthcare system. We got there through a thorough and deliberative process that brought every key stakeholder together and identified the barriers that individuals and providers were facing in search of quality care. From that process, we developed a comprehensive package of reforms across the industry that targets the practices that actively make care less affordable and harder to access. We had to work one by one through all of these things to eliminate those barriers. This new law eliminates step therapy, a practice where insurance providers require patients to try and fail often less effective treatment options before getting the care originally recommended by their doctor. Perhaps this seems controversial to the insurance companies, but I don't believe an insurance executive hundreds of miles away knows more about medicine than the doctor in the examination room with the patient. We also eliminated prior authorization for inpatient mental health care because a person in need of immediate help shouldn't have to jump through hoops during a crisis. Illinois, by the way, is once again a pioneer, the first state in the nation to do this for adults and children. I'm going to digress from my speech a little just to tell you that I got a call shortly after I talked about this bill in my State of the State speech when I introduced this, from a longtime friend who had not revealed to me what he said, which was that his daughter had attempted to commit suicide, and then she tried again a second time. And on that second attempt, he was in the emergency, he was in the ambulance on the way to the hospital with her, calling the hospital and then calling the insurance company, needing prior authorization. And they denied him prior authorization. And he had nowhere to go. He had nothing, there was nothing left for him to, he could not take his daughter home after she had attempted suicide. He could not take her anywhere else. This was the only hospital that could take a patient like her. And he was lucky. He knew the president of the hospital that he was headed to, so he called him at 12:30 at night, and was able to make arrangements for himself. But almost nobody has that ability. And when he called me, he said, he was almost crying on the phone. He said, "Thank you. You've changed people's lives." And I think about that a lot, that particular instance, and I'm choking up thinking about it, when I think about what we've done here with the HPA. We really have saved lives. So we did even more in this legislation. We increased transparency in insurance coverage. We set new standards for appointment time availability and number of in-network doctors. We banned the sale of junk insurance plans that don't meet the affordable. Those are plans that don't meet the standards even of the Affordable Care Act. We eliminated ghost networks. For thousands of Illinoisans, the reforms in this bill will mean the difference between, suffering with curable health conditions and getting the care that they need in a timely manner. And for some, this bill will quite literally save their lives. As you can tell here at Rush Medical Center, Illinois has some of the smartest, and kindest and most advanced healthcare professionals in the entire world. And with my signature today, we're going to make it easier for them to do what they love and what they do best. Thank you to all of you who are here to stand up for the people of Illinois. I look forward to building on this progress to make sure that every resident of this great state, regardless of their age, race, income, or zip code, gets the quality care that they deserve. With that, it is my great pleasure to introduce a leader, a partner, a friend, our Senate President, Don Harmon.
Well, good morning, all. Good morning. Thank you to the Rush family for opening up the facilities here for us today. The Illinois Senate Democratic Caucus has long been committed to quality, accessible health care. And in addition to our sponsors, we are joined here with several health care champions, Senator Willie Preston, Senator Lakeisha Collins, Senator Rachel Ventura, among others, all here. So please give them a round of applause. It's also a point of pride that we have a couple of Senate alums on the roster as well for speakers, including the former Senator, now Director of Insurance, Ann Gillespie, and former Senator, now Head of the Hospital Association, A.J. Wilhelmi. Testament to our long commitment in the Senate caucus. Thank you to a world-class team of healthcare professionals here at Rush for the excellent care that you provide in this community. Thank you to the sponsors of these new laws, Senator Robert Peters and Senator Laura Fine. Without your hard work and unwavering belief that health care should be accessible to everyone, none of this would be possible. You really did a remarkable job in getting this over the finish line. Today's bill signing is the culmination of a massive effort on the part of our colleagues, Governor Pritzker, and advocates. A massive effort to put into law something that seems like it should be common sense. Health insurance companies should be focused on making people healthy. But somewhere along the line, priorities got out of whack. Instead of helping patients find the best care for their individual needs, the focus too often shifted to maximizing profits. These laws to be signed today put control back in the hands of patients and their doctors. They ban predatory insurance plans that charge more for a lower standard of care. They eliminate inefficiencies that cause patients to wait far too long for necessary treatments. They will lower health care costs, and they will save lives. So thank you again, Governor, Senator Peters, Senator Fine, for your great work and your dedication. With that, it's my privilege to welcome up another partner and a good friend, the Speaker of the Illinois House, Speaker Chris Welch. Where'd you go?
Good morning, everyone. I want to thank my friend, the Senate President. He's been trying to recruit me to the Senate for a long time. I like my job in the House, though. I'm thrilled to stand here with Governor Pritzker, Lieutenant Governor Stratton, my colleagues in the House and Senate, and the countless advocates that helped get these monumental pieces of legislation on the governor's desk today. I want to give a special thanks to my colleagues in the House, Leader Camille Lilly, Representatives Moeller and Representative Morgan, true healthcare champions that really helped get us here today. Can we give them a round of applause, please? You know, I want to give a special shout out to Reps Moeller and Morgan. I got to tell you, they are tireless advocates for improving health care in the state of Illinois, and they worked really hard on these pieces of legislation. You know, this legislation will put the power back in the hands of patients, where it should be. Putting power back in the hands of patients by banning step therapy, banning prior authorization for crisis mental health care, improved network adequacy, banning junk insurance plans, and end unchecked rate increases by large insurance companies. We're putting patients before profits. We're putting patients' health care before large insurance companies. This is what it should be about. Today, we stand here making Illinois the first in common sense reform by banning prior authorization for inpatient mental health care. It was just simply the right thing to do, and I'm just so proud to be a legislator in the state of Illinois, putting patients before profits and helping to get us there, to help us land the plane with the Health Care Protection Act was Representative Anna Moeller. Please welcome her to the microphone.
Good morning. It's an honor and pleasure to be with you, and I too want to thank the superb healthcare professionals here at Rush. We are grateful for your service and all that you do for patients in our state. Today truly marks a milestone for the health and well-being of people in Illinois, and I'm honored to be here to witness the signing of the Healthcare Protection Act and to talk a bit about this transformative impact that this piece of legislation will have on our state. The Healthcare Protection Act makes significant reforms to tear down the barriers that have long prevented patients from accessing the health care that they need. For too long, these barriers, including the use of step therapy, prior authorization for crisis mental health care, unreasonably high premiums, and unjustified denial of treatment, have been a source of frustration, pain, and financial hardship for countless Illinoisans. With this act, we are taking bold steps to ensure that patients in our state receive the care that they deserve without undue delay or financial burden. I want to extend a deep sense of gratitude to Governor Pritzker for his incredible leadership and the superb professionalism of his policy team. Emily Miller has been mentioned already. Without their unwavering commitment to health and well-being of our citizens, in bringing this fundamental piece of legislation, this bill would not have come to fruition. Governor Pritzker, your dedication to healthcare reform has set a new standard for what it means to serve the people of Illinois. I also want to acknowledge my colleagues who are here and the colleagues in the House who helped get this legislation over the finish line, including Leader Lilly and Representative Morgan, who sponsored the legislation that bans junk bonds or junk policies. We would not be here without their support. I want to also acknowledge my appreciation for Senator Peters. It was a joy to work with him in partnership on this bill. This legislation is a testament to what we can achieve when we come together with a shared purpose and a common goal. I am also profoundly grateful to the healthcare professionals and patient advocates who helped pass this legislation. Their tireless efforts and advocacy, their testimony in committee, sent a clear message that Illinois deserves better. We heard gut-wrenching stories about why this legislation is so necessary and will save lives. This act is not just about policy change. As has already been stated, this is about prioritizing people over profits. It's about recognizing that healthcare is a fundamental right, not a privilege. It's about ensuring that our healthcare system serves the needs of patients and supports the dedicated professionals who provide their care. In closing, I'm proud to say that with the signing of the Healthcare Protection Act, we are taking a decisive step towards a future where healthcare in Illinois is accessible, affordable, and equitable for all. It's time to put patients over corporate profits, and this law will finally deliver on that promise. Thank you. And I am honored to introduce and bring to the podium Senator Peters.
Good morning. This is a huge day in Illinois. I want to thank the governor, my colleagues in the General Assembly, patient and healthcare advocates, and hospital leaders. I'm especially grateful to be at Rush Hospital. I suffered a very painful fracture to my tibia plateau while playing soccer during the summer of 2018, and the wonderful doctors and staff at Midwest Orthopedics took amazing care of me. And another Rush story that I like to share is when I learned I was adopted, my mom decided to read me my medical report, which talked about me being born hard of hearing. And at the top of it was Rush Hospital. So I'm grateful for Rush Hospital for all that you do. Thank you. This is my message to Illinoisans. Illinois is moving in a positive direction when it comes to your care. Whether it's reproductive care, painful physical care, traumatic mental health care, Illinois, with this governor and this General Assembly and these leaders, is not turning back the clock nor turning back patients when it comes to your care. We're going to ease the stress for you and your loved ones during a mental health crisis. We're going to reduce the confusion when it comes to finding a provider. And instead of the steep steps of care that existed before, we're building an elevator to the treatment you need and deserve. We're ending predatory practices during your most vulnerable moments. In Illinois, we are putting care over cost. And I want to go back to Rush here. I have another memory. There was a moment after my dad died and before Obamacare fully took effect that I was dealing with a medical emergency that made it hard for me to get good care, particularly due to a pre-existing condition. I was desperate, and I came to this hospital's ER to seek help. I was lucky to have found a doctor who gave me antibiotics and sat with me as I struggled to explain the chronic pain I was in. He sympathized with me and gave me some advice. Our systems work best when it is putting people first and it is driven by those values. I know that there are countless others who have or are facing similar challenges in life. And I want them to know that today, as these bills get signed, we are all here doing this work with you, the person in serious need, front and center. Thank you, everybody. And I would like to introduce a fighter for patients her whole career, Senator Laura Fine.
Good morning, everybody. Thank you, Senator Peters, Senator Harmon, everybody who has worked so diligently on this legislation. Another shout out for Emily Miller, who has devoted her career to this as well. Imagine going to the doctor and learning of your diagnosis of cancer or MS. Now imagine your insurance, which you thought was there to protect you in a crisis, did not cover a new diagnosis, a pre-existing condition, or even your prescription medication. This nightmare has been a reality for countless people in the state of Illinois. These residents purchased short-term limited duration plans for their health insurance coverage. Sadly, these consumers found that when they were at their most vulnerable and needed to use their insurance, their plan had a high deductible and minimal coverage. This has left many under huge medical debt. Short-term limited duration plans, also known as junk plans, are exempted from the protections under the Affordable Care Act. These plans are not required to cover ACA essential health benefits like prescription drugs, maternity care, hospitalization, ambulatory services, mental health and substance use disorder treatments, or even emergency services. These plans cost the consumer and profit the insurance industry. Comprehensive health insurance coverage is required to have a loss ratio that is at least 80%, meaning the insurance pays 80 cents on medical claims for every dollar it charges in premiums. But junk plans have no mandated loss ratio, and in Illinois, some can be as low as 32%. That means junk plans, insurance companies are keeping 50% more profit than they do for comprehensive health insurance. That burden is on the shoulders of the consumer. With this legislation banning the sale of junk plans, individuals and families in Illinois will have a better option when they need coverage due to issues like job loss, turning 26, or moving off of Medicaid. Illinois will soon have a state-based exchange where consumers can go to purchase a temporary ACA compliant plan and possibly receive government subsidies to help them pay for this comprehensive coverage. This will ensure consumers have the insurance coverage they need for better outcomes. I would like to extremely thank Governor Pritzker, our incredible Lieutenant Governor, the amazing advocates, because these advocates are on the front lines every day fighting for what people need. The Department of Insurance for their advocacy on behalf of all consumers in the state of Illinois. And with that, I'd like to introduce my partner in this fight, Representative Bob Morgan.
Good morning. And thank you, Senator Fine. Approximately 6 months ago, Governor Pritzker introduced the Health Care Protection Act. And there was a lot of grumbling. There's a lot of skepticism. I heard a lot of people that doubted whether or not the governor and the legislature was going to follow through on such transformative health care insurance reform. But with the governor's ironclad commitment and with incredible, terrific leaders like Representative Moeller, Senators Fine and Peters, we got this done. Not without, of course, the amazing help of policy leaders like the Shriver Center and also Inseparable. In addition to driving down health insurance costs through rate review, something Senator Fine and I have been working on for years, ending step therapy and prior authorization, and rooting out ghost networks, today we ban junk insurance in the state of Illinois. Too many residents in Illinois have been tricked into buying these limited duration plans for bridge insurance coverage, only to find out they were flying a plane without a parachute. The junk insurance, yes, it may be cheaper than being fully insured, but many of these junk plans do not cover behavioral health. They do not cover pre-existing conditions. They may not even cover hospitalization. What kind of health plan doesn't cover hospitalization? A plan that is not a plan at all. Preying on the sick, vulnerable, and budget constrained is deceptive. It's a malicious practice. And come January 1st, this practice is going to end in the state of Illinois. I'm incredibly honored to have been a part of some of the major healthcare reforms that we have passed in past years, and you can bet that we will build on this momentum to lead the nation in healthcare in the years ahead. Today marks a major step towards healthcare equity, and we will use this legislation as a benchmark for our future efforts towards a healthier Illinois. Believe me, this legislation has grabbed the attention of elected leaders throughout the nation, looking for ways to increase healthcare costs and accessibility. Today, to increase the access and affordability, rather, decrease costs. Today, Illinois is truly walking the walk and enacting meaningful health insurance reform. Thank you so much, and it is a pleasure and an honor to introduce my friend and partner as the Director of the Illinois Department of Insurance, Ann Gillespie.
You know the drill. Good morning. Thank you, Governor Pritzker, for your leadership on health insurance reform in Illinois. As Acting Director of the Illinois Department of Insurance, I'm proud to stand here with you as you sign the Healthcare Protection Act, and I appreciate you entrusting the Department of Insurance with this important work. Having spent my career in the healthcare field, I know firsthand the challenges that consumers face navigating health insurance coverage that all too often puts them in the middle between the advice their providers give and insurers, and the critical role that state regulators serve in the insurance industry. So I welcome the department's increased authority under HPA to hold insurers accountable to cover the healthcare services consumers pay for every month without making them jump through hoops. I'm proud that Illinois is now the first state to ban prior authorization for inpatient adult and children's mental health care coverage, further increasing protections for mental health, adding to those already enforced under the mental health parity laws. I'm proud that Illinois will now require even greater network transparency and protections for consumers that they need to ensure that their trusted provider is an active member of the insurer's network before they purchase coverage. That transparency protection will now extend beyond the initial purchase by requiring insurers to provide the department every 90 days with an up-to-date audit of each network plan so that consumers have information about any recent changes. As we transition to the state-based ACA marketplace, HPA's ban on short-term limited duration plans will help the department ensure that Illinoisans do not mistakenly purchase inadequate health coverage instead of affordable, comprehensive coverage offered on the ACA marketplace. Protecting Illinois insurance consumers is our top priority at the department, and we stand ready to enforce the Healthcare Protection Act. I look forward to joining forces with other Illinois agencies and leaders to make sure that all Illinoisans can access health care and coverage that they need. And now I'd like to introduce Stephanie Becker, Director at the Shriver Center on Poverty Law.
Good morning. At the Shriver Center and as part of Protect Our Care Illinois, we work with and for people who struggle to get the health care they need due to insurance industry roadblocks. Over the past 6 months, patient advocates like these have shared their stories to show the necessity of the legislation being signed today. One is Cody, who was diagnosed with multiple sclerosis in 2017. His short-term junk plan refused to cover the life-saving treatments he needed, so he went into debt to pay his bills. Another is Marilyn, who is in the audience today. When her son was diagnosed with Hodgkin's lymphoma, she was forced to fight insurance company red tape to get the coverage for medications he needed, but had been unfairly denied. We believe that a person with MS or cancer should be supported to fight the disease, not forced to fight the insurance companies. That's why we supported the Healthcare Protection Act. And because of patients like Marilyn and Cody, the legislators who voted yes, and the governor signing the bill today, we are changing the landscape for patients and families like them for now and in the future. Healthcare should not be a constant fight for what you need. Patients should be prioritized over profits. Today, we celebrate the signing of these two bills, which together will ban junk insurance plans and protect Illinois consumers from other unfair and burdensome industry practices. On behalf of the communities we serve, we applaud Governor Pritzker, the Departments of Insurance and Healthcare and Family Services, and our legislative champions on the enactment of this historic piece of legislation. Thank you so much. And now I'd like to bring Bill Smith up.
Good morning. Well, it's so wonderful to be with you today, and I know it feels like everything's been said, but not everybody said it. But I'm with Inseparable, a national mental health advocacy organization founded on the idea that the health of our minds can't be separated from the health of our bodies. And we're so grateful for these legislative champions in both chambers who've been leading for years on this, and for Governor Pritzker's extraordinary leadership today. I also want to thank Heather Weirvault and Dave Horwich, who've led Inseparable's work in Illinois for years. 6 years ago, last month, I lost my brother to suicide after a really long battle with bipolar and depression. This loss devastated our family, and I know, unfortunately, our family is not alone. But I want to celebrate this legislation because there are so many families in Illinois and across the country who've experienced the same problems that my family did, mainly that coverage doesn't always equal care until today. This law is for you if you or your loved ones have ever struggled to get the right medication to treat mental illness and have been told by your insurance company that you have to fail first with the wrong drugs before getting the treatment that you need. If you've ever had a family member, as the governor mentioned in that incredible story, that's in need of inpatient mental health care, only to have to fight insurance company denials through prior authorization, this law is for you. And if you've ever called through an insurance provider directory trying to find a mental health provider only to be forced to wade through inaccurate information, wrong numbers, bad addresses at the moment when you really need help, this law is for you. These legislative champions and Governor Pritzker, you are leading the country right now. And at Inseparable, we're going to work to make this the law of the land for everyone in our country. But we wanted to come here and say thank you because Illinois is doing it first. We just need every governor in the country to show the kind of vision and dedication and leadership that Governor Pritzker has shown. I'd like to now introduce A.J. Wilhelmi, President and CEO of the Illinois Hospital and Health Association.
Thank you. Good morning, everyone. Governor Pritzker, Lieutenant Governor Stratton, President Harmon, Speaker Welch, distinguished members of the General Assembly, and members of the Pritzker administration. It is such a pleasure to join you on this special occasion. And I also want to give a special thanks to Dr. Lateef for hosting us today and for remarkable leadership here at Rush. On behalf of our 211 hospital members at IHA, I applaud Governor Pritzker, Representative Moeller, and Senator Peters for advancing the Healthcare Protection Act on behalf of Illinois patients and their families. In February, Governor Pritzker made it clear that the HPA would be one of his top legislative priorities for the spring session, and he did a remarkable job making the case for this legislation, which is all about protecting patients from predatory health insurance practices. For years, we've heard from our member hospitals that prior authorization delays and denials are a top challenge in delivering timely and appropriate health care, especially when it comes to critically important mental health services. So IHA welcomed the opportunity to work with the Pritzker administration on this proposal, which will make Illinois the first state in the nation to prohibit prior authorizations for inpatient mental health admissions. The hospital community also supported provisions in the HPA targeting practices that allow an insurance company to override a physician's judgment. These are profit-motivated strategies that benefit the insurance company's bottom line at the expense of the patient. As the governor said many times this spring and again today, it's time to put medical decisions back in the hands of patients and their doctors, and the HPA will help to achieve that important objective. So on behalf of our member hospitals, their healthcare workers, and the patients they are privileged to serve, I want to thank the governor and the bill sponsors for their outstanding work on the Healthcare Protection Act. This new law will empower Illinois' healthcare community to deliver the best possible care for their patients. And now it's my pleasure to introduce Dr. Villas from the Illinois State Medical Society.
Okay, good morning. I will start with our best Governor Pritzker, all the leaders here, and ladies and gentlemen. It is very difficult to speak after all the good speakers have spoken already. And I've been traveling abroad lately, and I also have a cold, so you will excuse me. The Illinois State Medical Society appreciates the governor's strong support of putting the medical decisions back in the hands of patients and the doctors. And that is the reason why he was the best governor of the United States. The health insurance reforms passed by the Illinois lawmakers, many of them are right here, will ensure that administrative delays caused by the insurance companies as well as their inadequate provider network, so-called ghost network, should be a thing of the past. So I want to thank all the people from Illinois lawmakers who passed this law. Every person in Illinois, if you want to make sure that every person in Illinois deserves the access to the quality of health care, affordable health care in their communities without any delay and without interruption of the treatment. So this is very important, and this particular governor, I want to thank this governor. He has been taking care of the patients. Illinois Medical State Society is also doing the same thing, to make the doctors and the patients more important, and that is the only way to take care of the patients. And thank you, Governor Pritzker, for signing this new bill which we're going to sign. And we really appreciate the Illinois State Medical Society and their almost 8,000 members to appreciate Governor and their team for doing such a great job. Thank you, Governor Pritzker. Sorry, Governor reminded me. I knew that. I need to introduce the most famous and most beautiful Lieutenant Governor Stratton.
Good morning, everyone. I am Lieutenant Governor Juliana Stratton, she, her pronouns, and thank you, Dr. Villas, for your words and for the good work that you do caring for our communities. And thank you to Dr. Lateef and everyone at Rush for hosting us and welcoming us into this space. In the interest of time, I will echo the appreciation that's been shared. Thank you especially to President Harmon, Speaker Welch, and our incredible colleagues in the General Assembly for your partnership, and of course, our bill's chief sponsors, Representative Anna Moeller and Senator Robert Peters, for your inspiring leadership. I do also want to thank all of the patient advocates who told your very personal and very powerful stories. It's so clear that your voices matter. And for as long as I've known him, Governor Pritzker has been focused on delivering tangible results to every resident of Illinois. Among his many priorities, access to quality, affordable health care has been at the very top. Throughout our administration, I've emphasized what the governor's signature does for people. When his pen touches paper today, obstacles standing between Illinoisans in need of care and their doctors' prescribed treatment plans will soon disappear. The Healthcare Protection Act unequivocally takes power out of the hands of insurance companies and places it squarely where it belongs, in the palms of the people. Perhaps most of all, I'm thinking about how this will change and save the lives of those experiencing a mental health crisis. Let me be clear. Insurance-invented roadblocks like prior authorization requirements have put people directly into harm's way. A crisis is never convenient. To demand that someone at their lowest moment has the foresight to seek insurance authorization in advance is both unsafe and impractical. When you need help, you need help. And rather than perpetuate a cycle of harm which leads to trauma, which in turn leads to generational mistrust in support systems, we are changing the status quo. The frustration Illinoisans have come to expect from private health care, well, it ends now. So, for the moms trying to soothe a sick baby, for the caregivers up every hour with their loved ones, for the spouse holding their partner's hand through a tough treatment, the Healthcare Protection Act is tangible change. That is what leadership is about, making life better for everyone. And how lucky are we that leadership is modeled with such compassion here in Illinois. Thank you, Governor Pritzker, and thank you all for being here. And with that, let's get to signing this bill into law.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.
That Congress and the Senate will have to have is whether or not White House policy is enough. I think they're well-intentioned. I think they want to fix a problem that exists. But we've had this conversation before. In about 2010, 2011, when the avian flu was mutated to become aerosolized and more easily spread among mammals, there was a pause between 2014 and 2016. But throughout the pause, there were exemptions given to many research, and then there's some research that mysteriously just doesn't show up in any documents. So, for example, the research in Wuhan that many of us believe evidence points towards the lab leak causing the pandemic was never reviewed. We then set up a committee called the P3CO committee, which was supposed to be in charge of looking at the safety of dangerous research. They looked at exactly 3 research projects. They complained and said, well, we didn't have the ability to go out and grab research. We could only take what was given to us. So there are limitations of the internal changes. In fact, one of the grave mistakes that was made is that the research in Wuhan was never even looked at by the P3CO committee. It was never paused. And Anthony Fauci will say, my people up and down told me it was not gain of function. And yet there's not one scrap of paper of any discussion ever occurring over whether it was gain of function or not. There have been camps for a long time. People say, oh, is this Republicans versus Democrats? No, but it's contentious, and there have been scientists on both sides of this from the very beginning. Really, probably all the way back to the Spanish flu in 2005, but certainly since 2007. And people need to realize that there are people on polar extremes, and Anthony Fauci was a polar extreme. He believed, and he said in 2012, that even if a pandemic should occur, the knowledge was worth it. So I guess my question to begin for Dr. Redfield was, do you think that taking a coronavirus, the backbone of a SARS coronavirus and swapping out S proteins from unknown viruses. Do you think that's research that should be scrutinized for potentially being gain of function or dangerous? Does it bother you that the internal regulations that were put in place didn't seem to work to catch that Wuhan research?
Yes, I think the problem is the program can't be passive. And I think while I respect some of the improvements that happened with the May decisions that the White House has, I still think this is sort of a passive volunteer program for compliance. And so clearly, I think there has to be a much more active engagement. And one of the things that I want to come back to that I said earlier, and people will disagree with me, but I think they should reflect on what I'm about to say. In 2024, 2025, biosecurity is our nation's greatest national security threat. You need to think of it the same way we thought about the verge of nuclear, atomic, and in the late 40s, 50s, and 60s. And, you know, Congress and our country was very aggressive in putting some standards around how we did nuclear research and where we did it. I think we have to have that same vigor towards this biological gain of function research right now. It has the potential to be much more catastrophic than, let's say, an isolated nuclear event.
So in preparing this bill to set up an independent board, we interviewed dozens of scientists. We asked them their opinions on this, what has to be done differently. And probably the number one thing people came back to us is that they believe the people making the judgment on the danger of the research should not be people dispensing money or receiving money, because it's just a conflict of interest. And accusations have been made. We don't know what people's motivations are, but when there are multi-million-dollar awards being given after certain opinions change or evolve over time, then the question is whether or not the money motivates the change. And really, so what we did in setting the independent commission up that we hope to pass into legislation is to have people who have, are no longer receiving, they could have been working for NIH, but they're no longer receiving benefits. They're not in the dispensing part, to try to get more objective look at this. We also put people on the committee that would have a national security look at this as well. And they can have both. People like Dr. Redfield have had both experiences of looking at national security and the science of this. And also, we don't ban anything. We don't ban gain of function research. It's really important what the definition is, and it requires some guidances and then scientists. But to Dr. Esvelt, do you think it's important that this be outside of the traditional NIH grant funding process and to get rid of conflict of interest, or do you think it can be done with in-house at NIH?
Thank you, Senator. I strongly believe that to provide trustworthy oversight, it has to be located outside the chains of funding in either direction, exactly as you outlined.
Right. Dr. Esvelt, the history of this, if you could sort of review again, just because some people think this started with COVID, you know, going back to Spanish flu and avian flu, that there's been really a long-running debate in the scientific community about the benefits. Some people say, well, as Anthony Fauci, the knowledge is always worth it, the risk doesn't matter, the knowledge is worth it. But then other people say we've never developed any vaccines from gain-of-function research and that it hasn't been nearly as productive as some would argue. Can you comment a little bit on the history of this debate, where the debate's going, and what your opinion is on Dr. Redfield? I'm sorry, I was directing that one back to Dr. Redfield.
I think it's an important debate to have, and I think you've highlighted. If I was sitting here 20 years ago, I would probably have the view that we may want to consider gain-of-function research as a way for us to get a jump start on countermeasures, because the pace of science was so slow. I know when I became CDC director, I was very concerned about a bird flu pandemic. And historically, if that occurred, it would likely take several years before we would have a vaccine or countermeasure. And so really for the first couple of years, it would just be a body count. But I will say the pace of science today is such that, and we saw it obviously with the COVID pandemic and the rapid development of the COVID vaccines, is such that we can really develop countermeasures really in weeks and months now. So I'm not of the view that we get such a jump start with gain of function research. And I do think there has to be a very aggressive debate of whether there's any benefit from that research. I think you are right. I'm not aware of any advanced therapeutic or vaccine that has come to pass because of gain-of-function research. So I'm still reticent. I do want to have a vigorous public debate about its benefit, and if it's determined that it has benefit, and I want society to be involved in that debate, not just scientists, then how do we do it in a safe, responsible, and effective way that protects our national security, which I do believe it has to be highly regulated.
Thank you. Senator Johnson, recognized for your
Thank you,
questions.
Mr. Chairman. Appreciate you holding this hearing. What I know of your bill, Senator Paul, I'm sure I'm going to co-sponsor it once I review it. But I want to take this in a slightly different direction because I've never had Dr. Redfield before me. The cover-up of the funding of dangerous research is not the only area that our federal agencies have been covering up, been lying to us, not been transparent. I've sent over 60 oversight letters to the agencies, been largely ignored. I'll flash this one more time. These are the last 50 pages of the Fauci emails that I've been trying to get unredacted for the last couple of years. One of my oversight letters, that's what I really want to focus on, is the standard operating procedures, Dr. Redfield, that your agency issued 9 days after you left. So I'm assuming you had some input in that or knowledge of it. So they issued a standard operating procedure in terms of the analysis of the VAERS system. Are you aware of that? That they were going to be doing proportional reporting ratios and empirical Bayesian analysis on VAERS?
Senator, I'm really not up to speed on that.
Okay, so is there any reason why the CDC, if they're doing those analyses, proportional reporting ratios and empirical Bayesian analysis, why they wouldn't release that to a member of Congress, a senator, requesting to see that data, and quite honestly, release it to the public? Is there any reason for them to withhold that information?
I totally agree with what you are pointing out. You know, I'm disturbed that there's not much more aggressive release to the public of the data they have about safety of these vaccines. I think it's not appropriate.
So they are withholding it.
Yeah.
I think I understand why. You know, let me put up my chart. It is true, by the way, they were touting VAERS. Mr. Tom Shimabukuro, in October of 2020, about a month and a half beforehand, was talking about what a great system this was going to be. Do you agree with that? I mean, I could give you the quote. So I don't want to trust me, you were touting the VAERS system. But once the numbers started coming in, you know, I think by April, we had over 2,000 deaths reported worldwide in the VAERS system. About 40-some% of those were occurring on days 0, 1, or 2. So that was concerning. I realize the limitations of VAERS, but here's the current VAERS report compared to other drugs, by the way. The top of the one is ivermectin. This is the one the FDA says horse paste. Come on, y'all, you're not a cow, you're not a horse. On average, over 27 years, 16 deaths per year. Okay, let's move this chair. Hydroxychloroquine, 80 deaths per year over 36 years. The flu vaccine, in 54 years of reporting, no, 33 years of reporting, a total of 2,500 deaths, about 75 a year. Let me skip ahead, because we have Tylenol, we have other things as well. The COVID vaccines, over 37,000 deaths. Today, by the way, 24% of those deaths reported are occurring on the day of vaccination or within 2 days. That's about 11,000 a year. So, Dr. Redfield, I appreciate the fact that you've actually admitted that vaccine injuries are real. They're a lot more significant. I mean, total number of adverse events reported, 1.6 million. And of course, one of the problems with VAERS is it dramatically understates the number of vaccine injuries. So, a couple questions I have for you, because you would agree that we were generally led to believe that the vaccine would stay in our arm, correct?
Yeah, I think, again, the people oversold the vaccine and didn't give transparent comments about the potential side effects.
So again, we were told it was going to stay in our arm, right?
Yeah,
Okay. We were told this is mRNA, going to degrade rapidly in our body, right? But it wasn't mRNA, was it? It was modified RNA.
Mm-hmm.
It was actually produced synthetically so it wouldn't degrade. And we now have studies that say the mRNA is circulating in the body at least, I think, 2 months, and we haven't done studies beyond that, correct? I know in your own practice, You don't administer that because you realize the spike protein is toxic to the body.
I prefer the killed protein vaccines.
When did you first determine, or when did you first find out about the biodistribution studies Pfizer had done that the Japanese regulators released in February of 2021?
Probably
on the lipid nanoparticles.
Yeah, probably somewhere in the spring or summer of 21. It was clear that the mRNA in some patients was persisting much longer than it should.
When did you find out about the biodistribution of the lipid nanoparticles, or when did people in the FDA, when should have they known about the fact that they were biodistributing all over the body?
Yeah, I don't know the answer to that. I was telling you the summer of 2021 is when I probably became more aware that this...
Only because the Japanese regulators released that. But again, this is part of the Pfizer studies. So they knew that the lipid nanoparticle, which is designed to permeate difficult to permeate barriers, correct?
Okay.
That's the design of the lipid nanoparticle. So they knew it was going to biodistribute all over the body, concentrating in the ovaries, the adrenal glands. It crosses the blood-brain barrier, correct?
Correct.
So what would, let's just, again, you're a doctor. What happens when you have a lipid nanoparticle biodistributing, and let's say this mRNA, this modified mRNA attaches to heart muscle? What is it? It injects itself into the cells, causes that heart muscle cell to produce a spike protein, correct? Which is toxic to the body. And then what does the body do?
It has a very strong pro-inflammatory response, which is problematic. Again, I think, Senator, what you're getting at, which I'm 100% agreeing with you, is I think there was not appropriate transparency from the beginning about the potential side effects of these vaccines. And I do think there was inappropriate decisions by some to try to report any side effects because they argued that would make the public less likely to get vaccinated. I do think one of the greatest mistakes that was made, of course, was mandating these vaccines. They should have never been mandated. It should have been open to personal choice. They don't prevent infection. They do have side effects. I'm going to clinic this afternoon.
But again, I appreciate your admitting side effects, but you have to admit the people of the agencies, the Marks, the Dr. Marks, the Dr. Woodcock, they're still by and large denying this, right? They're saying, well, they're mild, they're rare, and they're mild.
The FDA
they're not rare, and they're severe to death.
The FDA should release all of the safety data they have. I was very disappointed to hear that they were planning to hold on to that till 2026. That really creates a sense of total lack of trust in our public health agencies towards vaccination. It's counterproductive.
So, Mr. Chairman, I'm not getting cooperation out of the chairman of the Permanent Subcommittee investigation to issue subpoenas to get this information. You have not yet issued a subpoena to get the final 50 pages unredacted. I would suggest we do that. Again, as important as the cover-up of the origin story is, there's a lot more that's being covered up. The public has a right to know. We pay for these agencies, we pay their salaries, we fund these studies, and they're not giving them to us. So again, I would ask you, again, appreciate this hearing, this is important. There are many aspects of our miserably failed response to COVID that needs to be uncovered, not the least of which the sabotage of early treatment, which I didn't have time to get into. Thank you.
Thank you. I greatly appreciate the direction this series of hearings is going. Senator Paul's Risky Research Review Act is a giant leap for mankind. It might be the start of something that will save tens of millions of lives, and I commend him, and we'll do everything we can to put wind beneath your sail to get this across the finish line. My concern is there's not enough national security emphasis on this. It's stunning to me as I go back and talk to the folks that knew the most at the beginning of COVID were the national security people. They were not surprised at all. So Dr. Redfield, I want to talk about the next pandemic. And whether it's man-made or from nature, I don't care. We all realize the flu vaccine works 25 or 50% of the time. The mRNA vaccines were going to be the cure-all, that they're not. What do you think would be if you were going to line up a scenario for us to practice, what would be the virus? And talk a little bit about vaccines as opposed to therapeutics.
Well, I think it's very probable that we will have another pandemic. I think it's very probable that the pandemic pathogen will be bird flu. The current bird flu, as you know, is now in over 100 million chicken and turkeys in the United States alone. It's global. It's an H5N1 virus. That virus now has gone into 27 mammal species in the United States, including cats and mice and bears and surprisingly dolphins and seals. So it's quite extensive. It doesn't seem to have learned how to go mammal to mammal when it gets into those mammals. It seems to go bird to mammal.
Okay.
And you know, it's been in 5 humans in the United States since 2019. And it has been in about 888 humans across the world since 2003. And it raises concern because of those 888 individuals, there have been about 52% mortality. So there's a high mortality rate. So I think it's very likely that this virus will continue to go out and try to learn how to infect different mammals, including humans. And eventually, it will evolve so it can transmit efficiently human to human. We know exactly what has to happen for that to happen. There's 4 amino acids that need to change. It was published in 2012. I was not an advocate that it would be published because I thought it would show terrorists a recipe to how to create a catastrophic virus.
Yeah.
But it was published. You know, Senator Marshall, I'm a man of faith. I think it's kind of a miracle that no one's exploited that yet to cause global chaos. But I am more concerned that the virus could be created in university labs. Labs are doing experiments that are trying to understand how to manipulate this virus and then be subject to accidental laboratory leak. And once respiratory viruses get leaked, they're very hard to contain. So I'm very concerned about that. On the other side of your question, I think that the United States is not prepared proportional to the threat. As I said, I think this is the greatest national security threat our nation faces. We have a $900 billion Defense Department for the threat of China, North Korea, Iran, and Russia. We don't have really any systematic agency or network of private sector contractors to help us with the biosecurity threat, which I believe we should have. We need a proportional response to the threat. I'd like to see us build within the Department of Energy, since they're used to weapons of mass destruction, they have a good science base, for them to basically get the mission to help build our biosecurity response and then build a series of private sector enterprises, like you mentioned, antiviral drug development and vaccine, diagnostics, PPE, as well as medical equipment that you can predict we'll need. When COVID happened, you remember Vice President Pence went up to Michigan to the Ford manufacturers to ask them to stop making Fords and start to making ventilators.
Yeah, Dr. Redfield, if I could interrupt you. So I want you to really nail this, the vaccine versus therapeutics. Therapeutics stop transmission. So if suddenly we found, heaven forbid, the bird flu was in humans, we could go in there with a therapeutic and really stop the spread. Am I right or wrong?
Yeah, I think your point, Senator, is exactly right. Too much weight is on vaccines. They're part of the response, but it's not where the money is. The money is in antiviral drug development. That's where the money is. The way I keep my patients alive today that get COVID that are over the age of 65 is the antiviral drugs. And what we really need to have for bird flu, because we don't have them right now, is multiple antivirals that are highly efficacious against bird flu, and we don't have it. We should have it.
Talk about the supply chain, what we don't have in this country for you to be able to develop those antivirals. There's some chemicals and rare earth stuff that you need that I don't have.
Yeah, there's different technologies, and this is where I think this should invest in platform technologies that can protect us. Right now, for many drugs, you need to get an active pharmaceutical agreement and ingredient, and the sources of that is really 2, India and China, right? There's an alternative platform, which I'm a big advocate of, which is to use the mRNA platform, not for vaccines now, but for therapeutics.
Okay.
And if I do use the mRNA for therapeutics, what I need to do is just procure 4 nucleotides, which I can procure right now.
And then
I can put them
we're eliminating the risk of developing the vaccine to be leaked. I mean,
Yeah,
developing a vaccine often leads to leaks, it seems.
Yeah, I just think that we should have a robust therapeutic program that builds technology that's independent of needing to go get active pharmaceutical ingredients from China and India. And that technology exists today using the mRNA technology, not for vaccine development, but using it for therapeutic product development.
Dr. Esveld, let's talk about national security just one more time here. In my humble mind, a viral biosecurity issue is a bigger issue than China's military threat to us. This is way more important than how many more submarines we build. Those submarines are important. Why wouldn't we apply the same type of rules and regulations to anybody that's working with nuclear energy, nuclear physics, nuclear bombs? I mean, this is 10 times worse as well.
Yeah, Senator, I think you're exactly.
I'm sorry, let's get
Oh,
Dr.
I'm sorry,
Esveld's
go ahead.
opinion here.
Thank you, Senator. The answer is that even though there are many benefits to nuclear energy, there's a lot more benefits to biotechnology in many different disciplines. And so carving out the fraction that is dangerous and poses these risks to national security, which is overwhelmingly due to agents that can transmit efficiently. That is the tiniest fraction of all biomedical research. And I believe we dramatically underregulate that and frankly overregulate much of the rest of it.
Thank you. Senator Hawley, recognized for your questions.
Thank you very much, Mr. Chairman. Thanks to all the witnesses for being here. Dr. Wollenitz, if I could start with you. You served as the Chief of Staff to Francis Collins for 4 years, is that right?
That's correct, Senator.
From 2017 to 2021, is that
Yes,
correct?
that's
so
correct.
right through the heart of the pandemic.
Yes.
I noticed that Dr. Collins was intensely interested in discrediting the lab leak. I guess we'll call it a hypothesis. I think it's probably a little bit stronger than that now that we know something of what our intelligence agencies have long assessed. Last month, I had the chance to speak with Dr. Robert Gary, who sat right where you are, who co-authored that really, frankly, shameless propaganda piece, the Proximal Origin paper, which infamously stated that the SARS-CoV-2 is not a laboratory construct or a purposely manipulated virus. It went on to say it could not possibly have come from a lab. This, of course, we now know is not what multiple U.S. intelligence agencies assessed. What interests me is that your office was very involved in that paper, which was supposed to be an independent piece of scientific analysis, but Dr. Collins actually called Dr. Gary when he was supposedly working on the paper on February 1st, 2020. Is it normal for scientists who are supposedly doing independent research to get together and talk about how their conclusions are going to come out?
Thank you for the question, Senator Hawley. I think in general, yes, it is quite common for scientists across biomedical research fields, while they're in the process of doing research, to discuss with colleagues and other scientists. I do not believe that that is an accurate description of the conversations that took place.
Well, tell us, what were the nature of the conversations?
So, while I was not present for those conversations, my understanding based on readouts is there was a lot of interest in the origins and current understanding of SARS-CoV-2. And I think it's important when we're talking about the term lab leak theory to differentiate between the idea of a virus escaping from a lab, which is a biosafety violation, versus a virus that is engineered or manipulated in the lab and then escapes.
Yeah, and your boss and Dr. Fauci tried to discredit both of those things. They said that the lab was absolutely not involved. We know that at the time that this paper was supposedly being written, because we now have the private correspondence from Dr. Fauci, your boss said that it was a very destructive conspiracy to think that there was a lab involved. So he's on the phone with a scientist, quote-unquote scientist, who's supposedly writing an independent paper. By the way, Dr. Gary testified under oath that he was coming to his conclusions while this paper was being written. He was discovering the answers. But we now know that your boss was on the phone with him saying this is a very destructive conspiracy before the paper was even written. My question is, why was your office so intent on pushing to the public the idea that this could not possibly have been a lab issue. Is it because of the NIH's role in funding gain-of-function research at the lab? Is that the reason why?
So, Senator Hawley, I would say that in the event of any new and emerging infectious disease, if you've ever gone through a tabletop exercise in biosecurity,
Yeah. Answer my question. Is it because that NIH was actually helping to fund, EcoHealth was funding gain-of-function research?
No, I believe that's an inaccurate assessment.
In fact, your boss misled Congress and testified falsely that NIH and the EcoHealth had never conducted gain-of-function research at Wuhan, correct?
No, that's incorrect.
He did testify that.
I believe, sir, that what he testified to was that there was no evidence at that time that NIH was funding research that met the scope of the P3CO policy, which I want to differentiate from the term gain-of-function research,
Oh, of course,
which is a
this is the
broader
classic.
term.
This is the classic. Now that we've lied, now that you have, and your office, lied to the American people for years, told the American people that a lab leak was a very destructive conspiracy. That's your boss's statement while you were his chief of staff. Of course, we now know that that was the conspiracy to hide this from the American people, to censor people who went out and said, you know what, actually, maybe this is a lab leak. Your office, Dr. Fauci and others tried to actively censor them. There was a propaganda effort that this paper was the center of, and now everybody says, oh well, we just weren't sure at the time. We didn't really know. You knew exactly what you were doing. You were actively misleading the American people the entire time. Get this, after that paper, it's really an opinion piece, was published, your boss then says to Dr. Fauci that he had really hoped that the paper would settle this. Is there anything more that we can do to shut down this destructive conspiracy? This is in April of 2020. And then Dr. Fauci went to the White House podium and said that absolutely there's no way that this could have come from a lab. Let me come back to my original question. Why was your office so intent on shutting down any talk about this being involved with a lab? Why? I don't understand it. Why the hysteria?
So, Senator Hawley, I will say that my understanding of the situation is that no one at NIH, including Dr. Collins, Dr. Fauci, myself, ever suggested that there wasn't the possibility that a virus had escaped from a lab.
Oh, that's ridiculous. Let me just stop you right there. I cannot have these lies just continue to be told over and over again. Sorry, and wrong. That's false. You people repeatedly said it could not have come from a lab. Your boss said it was a very destructive conspiracy. Not that it was unlikely, not that it was not the best idea, a conspiracy. And based on that, you censored, and your administration that you worked for actively censored scientists, journalists, and what we now know is our own intelligence agencies at the same time were concluding and briefing members of Congress that it likely was from a lab leak. I mean, it's extraordinary. And now you've been caught red-handed because you thought that the rest of us wouldn't find out. You thought that the public would always be kept in the dark. And as it turns out, we now know these emails have become public, that you were pushing this propaganda effort and yet claiming the mantle of science. Don't you see that what you have done has set back the respectability and integrity of science by generations? You were acting as propagandists. Do you regret your role in any of this?
So, Senator Hawley, I don't think you've characterized
Do you
my
regret your role in any of the
NIH.
misleading of the public? Do you regret your role in your office saying that a lab nexus here is a very destructive conspiracy? Do you regret your role in helping censor millions of Americans who were kicked off social media, who were disciplined at work for saying that maybe a lab was involved, which we now know the FBI thinks is the case? Do you regret it?
I do not believe I ever had the role that you're describing.
Do you regret anything that you did during this period? Do you regret not speaking out? Do you regret not advising your boss to temper his comments? Do you regret not opposing the censorship? Do you regret it? You're in a position of tremendous influence.
I do not believe censorship took place, sir.
You don't believe censorship took place?
I do not.
What world are you living in? Tell that to the scientists who basically lost their credentials. Tell that to the people who were kicked off of social media and banned because they asked about a lab leak. You don't believe censorship took place? The privilege is astounding. You were the chief of staff at the NIH pushing these conspiracies, pushing the effort to shut down Americans, and now you have the gall to sit here and say censorship never took place. I mean, it's unbelievable. Unbelievable.
Senator,
I can't believe, I cannot believe that that's your testimony. And frankly, I can't believe you have the gall to sit here and say that. Thank you, Mr.
Wolinetz, during your tenure of working for Francis Collins, he sent an email to Anthony Fauci, and in the email, he said that he directed Anthony Fauci to orchestrate a takedown of Drs. Kuldorf and Bhattacharya. Were you aware of that email at the time?
I don't specifically recall it.
Okay. I want to remind the panel that you all continue to be under oath, and it is a crime to lie to Congress. Were you directed by Francis Collins to participate in a takedown, malignment, disparagement of either Drs. Kuldorf or Bhattacharya?
No.
Did you plant any articles or discuss with anyone in the media articles that disparaged Dr. Kuldorf or Bhattacharya or their positions?
No.
In Dr. Fauci's response to this email, he responds by saying, don't worry, this is a paraphrase, don't worry, Dr. Collins, I'm on it. I got a story planted in Wired and I think another lay publication, but he was actively doing Dr. Collins' bidding. So I am surprised that as the chief of staff, you had no awareness of that there was a policy of taking down these scientists. Dr. Parker, you've had long distinguished careers. Have you ever directed any of your employees to take down fellow scientists who you disagreed with?
No.
Dr. Redfield, you've had a long and distinguished career. Have you ever directed any of your employees to take down scientists who you had a disagreement with?
No.
Dr. Esvelt, same question.
No.
Dr. Wolinetz, did you attend the gain-of-function dual-use research of concern meetings during your tenure in government?
Yes.
Were you considered to be a member?
A member of what specifically,
I don't know.
Senator?
Is there a group called that? Is it a meeting? Who gets to go? Were you?
So I participated in many groups inside governments in which biosecurity, management of dual-use research.
This is a very specific meeting, though. This is the week, it's called in this email, Weekly Dual-Use Research of Concern Gain-of-Function Meeting. Did you attend those routinely?
I don't recall a meeting called that, although it's quite possible I was involved. That name doesn't ring a bell.
This would be a meeting to discuss things that might be gain-of-function. Did you attend those meetings?
No, not if they were meetings at the level of an individual NIH institute to review research. I was not at all involved in that process.
This is a email. It's from Teresa, I don't know how you pronounce it, Hogwell? How do you know how to say it? H-A-U-G-U-E-L, and it's to, let's see, Irene Glowinski, Dennis Dixon, Linda Lambert, David Spiro. You familiar with those names?
I believe those are all employees of NIAID.
Okay. So you think this meeting may have occurred within NIAID and you might not have participated in it?
Yes, that's correct.
Okay. Are you surprised that when I asked for the debate over what is and what is not, because there's a debate over what is the definition of gain of function, that the NIH still refuses to give me minutes of these meetings or any of the discussion concerning what is gain of function and what is not gain of function?
I can't speak to NIH's decision.
Do you think that's an appropriate policy for the NIH to refuse to give members of Congress the debate over whether something is or is not gain of function?
My general philosophy at NIH was to always be as cooperative with members of Congress as humanly possible.
Your boss, not so much. When he was for that when he wasn't busy taking down fellow scientific colleagues. Dr. Parker, do you think it's appropriate for the NIH to refuse to give Congress the minutes or deliberations over what is or what is not gain of function, particularly concerning research that was done in Wuhan?
Inappropriate.
Dr. Redfield, do you think the NIH should release, do you think it's inappropriate that they won't release, and should they release the information concerning the deliberations over gain of function?
Yeah, I think it's inappropriate that they don't share that information.
Dr. Esfeld, do you think it's inappropriate that the NIH continues to refuse to reveal information considering the deliberations over gain of function?
I think transparency is essential to public trust in science, and I think NIH has a duty to uphold public trust in science insofar as possible.
The public needs to realize that I only know of this meeting existing because of a Freedom of Information Act. The Senate, groups of senators, the ranking member of a committee, they will not reveal they even have the meeting, much less the minutes of the meeting. I can get more information from the CIA than the NIH. Dr. Redfield, do you think that damages science when the science are acting like the CIA and not revealing information? Does it damage our trust in science?
I think it's going to be very hard for public trust to be regained, at NIH, CDC, FDA, from what we experienced in the COVID pandemic.
Dr. Redfield, do you think, we talked a little bit about this before, but taking the backbone of a SARS virus and adding various S proteins from other unknown viruses to see what you get, running through that through serial passage, should that have gone before some sort of gain of function review, even if it, to figure out whether it meets a definition of dangerous research?
Yes.
One of Anthony Fauci's responses has been, well, they're two animal viruses and we don't know that they will infect humans. But by the time you combine them, the test they do is they actually test them to see if they infect human cells after they're done manipulating them. So their goal really is to see, hey guys, do you think we can make it more infectious? And yet they say, and they hide behind definitions of, well, we didn't know in advance. And this becomes the problem. And look, I come from a scientific background. I'm aware of CRISPR technology, not enough to do it, but aware of the great benefits of science. I'm aware of creating bacteria that make insulin. Not against any of those kind of things. But I do want scientists like yourselves to be on some sort of committee to overlook this. But I get the feeling that over and over again, this has been hidden and been in-house. There was actually, and I'm trying to remember if it's the same board that you led, Dr. Parker, but it's the NAA, remind me the acronym for your board?
NSABB.
And you're still ahead of it.
I'm still a member of the committee, but any of my comments today are not reflective. They're on my.
And I won't put you on the spot on this, but there's a story from like 4, 8, 10 years ago of like a whole bunch of people being fired by Dr. Fauci because they disagreed with his opinion on gain of function. And so that it's just another indication that we can't have this all within house and it's like, oh, no big deal. There really has to be some independent people outside of government to look at that. And that's what I emphasize over and over is that we have to get to some sort of independent board here. Dr. Wollenich, you were a member of the PC 3O committee, correct?
That's correct.
Who were the other members?
I don't recall all of them off the top of my head. There were about a dozen. I know there were representatives from ASPR, from the communications, Bill Hall at HHS. It's been a while.
Are you aware that they were also refusing to give us the names? I think the names have been published by the COVID committee. They've been refusing to give the names of the people on the COVID committee. I mean, on the.
As a member of the committee, previous member of the committee, I have no objection to the names being released.
But you can see the problem. So you set up an oversight committee, but the oversight committee never saw the Wuhan research. Should the Wuhan research, taking a SARS backbone and putting a new S protein on it and running it through human cells to see if it infects, and then it turns out it did, and then we say, oh, it's only 1,000 times more, and we'll give you more leeway to do it, et cetera, all the stuff that happened with EcoHealth. In retrospect, should that have gone before the P3CO committee?
So, Senator Paul, I think one of the things I've learned in engaging this, particularly as a non-virologist myself, although I'm a scientist, I don't know that much about virology, is that it's really important to have expertise to be able to evaluate that benefit and risk and talk about whether or not it meets the scopes of these policies. However, I do agree that, and I'm glad we're discussing whether or not there is an opportunity to do this better, to introduce independence earlier in the process.
That's a general answer, and that's fine. But very specifically, should the research putting a new S protein, a random S protein from a random unknown virus on a SARS backbone, creating an infectious chimera, and then deciding are looking to see if it infects human cells more. Should that have gone before the P3CO committee, yes or no?
I do not know enough about the research to be able to make that. That was why I was not part of the
See,
process that referred
that's
it.
really disappointing, and I mean, would exclude me from considering you for any board, frankly, if you can't admit, I mean, because you're still in your mind thinking, oh, I don't want to criticize Francis Collins, or I don't want to criticize Anthony Fauci, because this is your group, you know? But in retrospect, 15 million people died. The Department of Energy have concluded it came from the lab. So is the FBI. So did the CIA, until higher-ups at the CIA told them to change their opinion. But the group of scientists at the CIA, according to a whistleblower, voted 6-1. Look at what we're faced with. And people wonder about vaccine hesitancy or hesitancy of science. If you look at the information, for example, one of the strongest circumstantial evidence that they may have done this in the lab and that the furin cleavage site may have been added is the fact that in 2018, Dr. Shi and Dr. Barrick presented something called the diffuse proposal. Are you aware of the diffuse proposal?
I've read about it in the news, but I was not aware about it contemporaneously.
Contemporaneously, you weren't aware of it?
No, I'd never heard of it.
And here's the thing. Do you know how I'm aware of it? The NIH didn't tell me. The HHS didn't tell me. No one in government told me. A colonel in the Marines who worked for DARPA told me, under the protection of the whistleblower statute. In our government, we're concerned the Chinese lied to us and that they are distrustful, which is probably true. But in our government, you know, you may not have liked the tone of the other senators, but this is what we're faced with. The diffuse proposal was never told to us. In the diffuse proposal, it was a proposal to take a coronavirus, put a furin cleavage site in it, and test it to see if it was more infectious in humans. What did COVID-19 turn out to be? A very unusual, if not the first sarbecovirus in a family of viruses to have a furin cleavage site. It's why alarm bells went off in all of Anthony Fauci's cronies that were all saying it came from the lab, it looks like it was engineered, until they were convinced somehow within days to write the proximal origin paper saying it wasn't, and calling everybody crazy and a conspiracy theorist, and calling Facebook and everybody else and saying, take down, don't give any credence to these people. So you see what has happened to science. Francis Collins, your boss, at one point says, it's about, you know, damage to science. If anybody mentions that this might have come from a lab, it will damage science. Other people were saying it will damage our relations with China. So the truth wasn't so important. It was the business of science, the billions of dollars changing hand. And you and your boss, I mean, this whole cabal has created such damage to science in this, and it continues to this day. They will not give me the deliberations. We're not talking about secrets. We're not talking about informants. We're not talking about spies. I'm talking about scientists in my own government. Will not give me the deliberations on whether or not the research in Wuhan was. You still to this day won't admit it, even though the Department of Energy, FBI, and maybe as much as half of the scientific community are convinced it came from the lab. Even some might say it's 5% chance it came from the lab, and yet you won't admit that it's dangerous research. To this day, you will still sit there and say you're unable to judge whether the research going on in Wuhan was dangerous.
Senator Paul, I will say that the origin of the COVID-19 pandemic is unknown. When I was in the government, I had a high level of clearance and received the intelligence briefings to which you are referring. And my general conclusion is that there was a lack of consensus among analysts across the federal government. It was not as cut and dried as you are making it sound. I cannot speak to the innermost thoughts of anyone at NIH, but I will say in my personal experience, I never knew any of the scientists at NIH to be anything but open-minded because they thought that the information was power in being able to develop the diagnostics, treatments, and countermeasures, as well as future policies to help both address the COVID-19 pandemic and respond to future pandemics.
Dr. Wollenitz, have you visited the Rocky Mountain Lab?
No, I've never been there.
Were you aware of that the proposal to do the diffuse project involved laboratory work that was to be done at the Rocky Mountain Lab?
No, as I said, I was not aware of the diffuse proposal.
Okay. Senator Marshall.
Thank you, Senator Paul. Dr. Wollenitz, As you said earlier, you were part of the P3CO team, review team. Who decided that EcoHealth project should not go to the P3CO team?
Decisions about whether or not proposals met the scope of the P3CO policy and were referred to HHS were done at the cognizant funding level. So in that case, it would have been NIAID.
So Dr. Fauci would have had direct control of whether that project, that study should have went to EcoHealth?
It was more likely done at the staff level, but yes.
Would you agree with me that once research goes to China with American dollars, that NIH has zero control over the safety of that research?
No, I would not agree with that. I think it is really important to make sure that we put the proper terms and conditions in place on any federal award, particularly to a foreign entity, and all of the processes that meet those, whether it's the ability to inspect or require records.
So if you have faith in what's in our research, American dollars research in China, what is the NIH process for tracking research in China? And recall, regarding the transparency of this, recall that EcoHealth did not report its subcontract with the WIV to the public record database as well. So you're telling me, you sitting here, you're telling me you have faith that the NIH is appropriately supervising, making sure that the research done there is safe?
I think that if there is any evidence, as I believe there has been in the case of this particular lab, that they are not following procedures, there should be corrective action up to and including debarments for an institution if there's any evidence that they are not following the terms and conditions of their
Did
award.
NIH have any responsibility in ensuring they were following safety procedures, even doing the right research in the right biosecurity level lab?
Yes, absolutely. And I think this is a ripe area for the committee to think about strengthening the biosafety system. Right now, our biosafety system very much depends on guidelines and professional judgments. I think there is more we can do in terms of adopting standards and norms that provide systems of accountability so that we can be assured that the highest levels and practices in biosafety are happening.
In light of EcoHealth's research project concealments, including late reports and misrepresentations, and in light of NIH being surprised that Boston University conducted gain-of-function research with monkeypox virus fairly recently, has NIH undertaken a full review of its research to identify gain-of-function projects? And if not, why not?
I cannot speak for NIH, sir. I have not worked there for more than a year.
Were you aware of any type of improvement, full review of these research projects then before your departure?
These projects, could you be more specific? I was not aware of a sort of overarching review of projects.
Was this monkeypox virus before or after you left? I don't recall.
I do not recall hearing about it before I left, so I'm guessing the concerns were raised after.
Are you aware of any training that the NIH does, requires its researchers and grant recipients about the Bioweapons Convention Act and China's refusal to certify that they do not operate an active bioweapons program?
No, I've actually long been a proponent for including BWTC training and biosecurity and biosafety awareness training for scientists in general. I think that we should have the resources and tools to be able to do that.
Between January 1st, 2020, and the publication of the Proximal Origins articles, were you aware of Dr. Collins having any direct communications with the authors of that article, either through email or through phone call?
Yes, I was aware those discussions were underway. I was not directly involved in any of them.
Would you describe his conversations with them? Was it one or two? Were there many conversations? Was it mostly on the phone? Was it part of conference calls? Were minutes kept?
I do not recall the number of those meetings, sir. And I do not believe that there were minutes kept, because my impression was these were informal conversations between scientists, not part of a formal committee process.
Is that standard government procedure that they should be informal?
That conversations between scientists about science are frequent at research agencies across the federal government, and depending on the context, are often informal discussions. For example, program officers talk with scientists that they work with on a pretty regular basis about the progress for science, future science ideas, and those conversations are usually
From January
informal.
1st of 2020 and over the first 3 or 4 months of this pandemic, was there any type of national security officers, people from in the national security programs in advising Dr. Fauci and Dr. Collins?
As I recall, sir, I mean, in general, when there's an outbreak of an infectious disease, the National Security Council has the lead and runs points on the interagency
I understand that, but
policy
were they in there
process.
communicating with your people?
Oh, yes, certainly. I think at many levels, people across NIH were participating in those interagency policy conversations.
We're going to conclude very quickly. I just wanted to put into evidence for the committee hearing today. This is an email from June 17th, 2016, and it's from the weekly dual-use research of concern gain-of-function meeting. It sounds like all within NIAID. And the discussion was DASAX RO1/MERS/ERIC is the description. We were also, through Freedom of Information, nothing's been volunteered to us, but this is what we got as far as the deliberations. And it's insulting, not only to us, but really we represent, the people of the country. And look, 15 million people died. And the NIH won't give us the information on how the decision was made, that was fine research to do. This is incredibly galling. I hope this hearing is a way of bringing at least some of us together, that there has to be something done. I think there has been a consensus that there ought to be an independent board. We're very open. There is nothing set in stone. We put forward together the ideas in the bill. Almost every idea in the bill is from scientists. We're more than happy to hear more scientists. I want to get a result. I want an independent commission. I think it needs to be outside of NIH. And I think there's a possibility. So any scientists here or any scientists listening, we are very open to it. We don't want to exclude good research. This could be as many as 20 projects. It could be 100 projects. I don't know how many it is a year out of the tens of thousands of projects, but there ought to be a discussion whether or not, putting an S protein from a coronavirus on a SARS backbone is dangerous or not. And we ought to be able to come to an agreement. I think rational minds could. The hearing today, the record will remain open for 15 days until July 26th at 5 p.m. for the submission of statements and questions for the record. The hearing is adjourned. Thank you very much.
Madam President, one citizen, one vote. Today, this foundational principle is under attack. It's under attack because President Biden refuses to enforce the law. And now we face a direct threat to our entire electoral system. Consider this. Since President Biden's inauguration on January 20th, 2021, over 10 million illegal immigrants have entered the United States. Now, this figure exceeds the populations of 36 states, creating a crisis that has been met with troubling silence and inaction from far too many on the other side of the aisle. With millions of unauthorized people now on U.S. soil, living here in the United States, the potential for election fraud through ineligible voting is not just a hypothetical risk. No, it is a looming reality. With the influx of non-citizens under this administration, even if just a fraction, let's just say something like 1 in 100 were to vote, this could translate to hundreds of thousands of votes, enough to sway our tightly contested elections and potentially alter their outcomes. This is deeply concerning, considering that a recent study showed that non-citizens have ample openings to vote illegally. It found that anywhere from 10 to 27% of non-citizens are registered to vote, and 5 to 13% of non-citizens do actually vote in presidential elections, no less. Across the nation, instances abound where states have inadvertently facilitated this very crisis. From unsolicited voter registration forms being mailed out to non-citizens, to driver's licenses issued without adequate checks, practices relying merely on the honesty of illegal aliens have opened up the floodgates to voter fraud. While it's true that it's already illegal for non-citizens to vote in federal elections, there are no effective systems in place to verify the citizenship of voters. A mere check on a box is all it takes, with little risk of being caught. In short, you're on the honor system with those forms. Federal law even prohibits states from requiring proof of citizenship when registering voters via federal forms. So it's not just that the states aren't doing an adequate job of verifying citizenship as a condition precedent to registering to a vote in a federal election. They're prohibited by law from doing so. An increasing number of localities permit non-citizens to vote in local elections. And this makes it even worse. It further blurs the distinctions that have historically been meant to protect the integrity of our elections. Prominent Democrats have openly discussed these tactics, in many instances, as beneficial to their agenda, as likely to help their political ambitions. Only months ago, every Senate Democrat voted to count illegal aliens in the census to help them shore up more seats in Congress and consequently more votes in the Electoral College. This cannot continue. It's our responsibility, our imperative, to close these gates. My bill, the SAVE Act, would ensure that this stops, because it would be a vital step in securing the electoral process, ensuring that every vote cast is legitimate and every voter is duly recognized and registered and properly brought into the system so that they can vote. The SAVE Act amends the National Voter Registration Act, the same act that was interpreted a few years ago by the Supreme Court as prohibiting the states from requesting any positive proof of citizenship, so that states could ensure that only U.S. citizens may participate in federal elections. It fixes the NVRA. If the NVRA was interpreted that way, this would close that loophole. The SAVE Act requires states to obtain concrete documentary proof of citizenship at the time of voter registration. It specifies acceptable documentation and requires states to establish alternatives, alternative verification processes for those rare instances in which standard documents might be unavailable. Furthermore, the SAVE Act compels states to proactively remove non-citizens from voter rolls and introduces severe federal penalties for those who intentionally register non-citizens. This bill echoes the sentiments of the American people from coast to coast. It transcends political affiliations, with an overwhelming bipartisan supermajority of Americans supporting it. And it speaks directly to the core of what makes our country great: fair, free, and secure elections operating within our constitutional republic. This is about protecting our elections from foreign interference, something my Democratic colleagues claim to care about and long have. If we truly want our elections to be free of foreign interference, then by all means pass the SAVE Act. Let's pass it today. Let's pass it right now. So for those of my colleagues who are opposed to this, why aren't they concerned with the ability of tens of millions of foreign nationals, non-citizens in the United States, to vote in America. Why should we allow tens of millions of foreign nationals who are not citizens in the United States to vote in U.S. elections? Now, if the Biden administration insists on keeping America's border open, as to my great dismay, it has, for the entirety of the 3.5 years or so Biden's been in office, they're going to insist on keeping the borders open, then by all means, they must, at least at a bare minimum, ensure that none of those non-citizens are interfering in our elections. Every single day that we delay, the foundation of our electoral process erodes a little more. We cannot wait for this administration to enforce the law, to enforce the border, which they haven't done. They continue to refuse to do it. More people continue to enter. But in the meantime, they've let in 10 million illegal aliens. You add that to those who are already here, an estimated 30 million non-citizens currently reside in the United States. But this administration just keeps right on trucking, not doing anything about this problem. And in fact, this administration strongly opposes this legislation. Now, let's run through the reasoning. The reasoning is really telling. There are several arguments raised by the White House in the statement they issued just earlier this week. First, the White House protests, quote, "It is already illegal for non-citizens to vote in federal elections. It is a federal crime punishable by prison and fines," close quote. Now, to be clear, that is on its face a correct statement of the law. I won't disagree with the statement on its four corners, but the conclusion is really messed up. As I've already stated, there's absolutely no functioning mechanism for enforcing the law, and it's worse than that. It's not just that current law doesn't create an adequate enforcement mechanism. It's that current law, as interpreted by the Supreme Court, affirmatively prohibits the states from doing what they would need to do in order to prevent non-citizens from registering to vote and subsequently voting in federal elections, contrary to federal law. Meanwhile, DOJ investigations of illegal voting are all but non-existent. A law without enforcement cannot, will not stop illegal behavior. And there are many, many circumstances in which, notwithstanding the fact that the underlying conduct is criminally prohibited, you still need some sort of verification mechanism to make it enforceable. By the White House's own logic, it'd be unnecessary and perhaps even unwise to have laws requiring a photo ID to buy beer and cigarettes. You know, we've got these laws on the books, after all, that already make it a crime to sell beer and cigarettes to children. So according to the White House's logic, we shouldn't need an additional law requiring age verification with a photo ID. Now, nobody would be that crazy, that insane to make that argument there. We shouldn't be making it here. It's the same argument, the exact same argument. Next, in second position, the administration makes the unsubstantiated claim that, quote, "the justification for the SAVE Act is based on easily disproven falsehoods," close quote, end of sentence. But then, well, the administration utterly fails, defiantly refuses to offer anything to support that statement. It's ironic because that justification for opposing it, on grounds that the justification for the SAVE Act is based on disproven falsehoods, this is its own disproven falsehood. There's nothing there. There's no falsehood that's been disproven. They have not disproven the fact that non-citizens, whether legally or illegally in this country at the time, can easily obtain a voter registration, eligibility to vote in federal elections, or the physical ability to do it, rather, so long as they're willing to check a box and sign their name. They don't dispute the fact that in all 50 states and D.C., a non-citizen can apply for and receive a driver's license, or that the National Voter Registration Act makes it easy when applying for a driver's license to check a box and sign your name and thereby register to vote in federal elections. When you add to that the fact that states are affirmatively legally prohibited based on the Supreme Court's interpretation of the NVRA a few years ago, saying that the states cannot, may not, must not ask for any kind of documentation to verify citizenship, we've got a problem. So for them to say that our justification for the SAVE Act is based on falsehoods, on easily disproven falsehoods, is itself easily disproven, and it's a falsehood. Third, the administration asserts that, quote, making a false claim of citizenship or unlawfully voting in an election is punishable by removal from the United States and a permanent bar to admission, close quote. Well, this is an interesting argument. This one is rich, Mr. President, coming from this administration. Look, well, it's true that the naturalization form has a self-reporting mechanism that asks the applicant if the applicant has ever voted illegally. Yeah, that's true. As far as I can tell, even when they do self-report, in those, I suspect, rare instances where they do, absolutely nothing has been done with that information under the Biden administration. Joe Biden isn't deporting anyone for illegally voting. Joe Biden has opened the floodgates and just lets people come in. So that's rich coming from this administration, suggesting that there's going to be suddenly rigorous enforcement of laws governing our border security. In this instance, when, number one, they're not doing it, and number two, everywhere you look, they're doing the opposite of that. Fourth, the administration asserts, quote, states already have effective safeguards in place to verify voters' eligibility and maintain the accuracy of voter rolls. Mr. President, that assertion is simply flat out wrong. It's just false. It's false factually and it's false legally, meaning it is not true and it cannot be true by operation of law for reasons I've just explained. States are legally prohibited from requiring proof of citizenship when registering to voters, when registering voters for federal elections. This, I fear, may well be a feature, not a bug, for the administration, and a reason for the administration to oppose it, tragically. We'll get back to that more in a moment. But look, this loophole that I'm describing, based on the Supreme Court's interpretation of the NVRA, telling states that they may not and must not ask for any kind of evidence of citizenship, that's a gaping loophole that we must fix. Lastly, the administration claims that instead of safeguarding our elections, this bill, with its incredibly generous list of ways to demonstrate citizenship, would make it harder for Americans to vote. Well, look, the reality is that there's an expansive list of ways to demonstrate citizenship, even if you lack the documentation traditionally involved in proving it. And keep in mind, it's not unusual for Americans to be asked for proof of citizenship. Every single time an American citizen starts new employment, starts a new job, and they fill out an I-9, they've got to provide proof of citizenship. And if you're not a citizen, you've got to show evidence of your visa and your eligibility to work in the United States under that visa. If you can't do that, you can't start a job. This happens all the time. This is not as if the ability to prove citizenship and a requirement that one do so is foreign to us. Nor is it the case under this bill that it would be exceptionally difficult, because even if you're one of those rare individuals who, for whatever reason, doesn't have or have access to a birth certificate or something else that could prove it, we've got a long list of other ways that you can do it, even if you lack the traditionally utilized documentation. This bill allows all American citizens to vote. More importantly, if enacted, it would mean that no American vote could be canceled out by a vote cast illegally by a non-citizen. This bill would make it harder to cheat in elections and ensure the integrity of every ballot lawfully cast. There is no valid argument against the SAFE Act, Mr. President. None. The only reason to oppose this bill would exist if you needed illegal votes to win elections. Full stop, that's it. By passing the SAVE Act, we would send a clear message that in the United States of America, voting is not just a privilege of citizenship, but a cherished and protected right. As debates about election integrity rage, the SAVE Act stands out by guaranteeing that only American citizens can have a say in our elections. American elections must be decided by American voters.